perform preparing medication from ampule. So first thing we need to do is to do the assessment. First is to assess the client's allergies to the medication, assess the drug action such as the side effects, interaction or adverse reaction. Next is to assess the intended route. Next is to assess the client's knowledge or learning needs about the medication. Then assess the ordered medication for clarity and expiration date. If possible, perform appropriate assessments such as obtaining vital signs on the patient and checking the laboratory results specific to the medication. Next is to do the planning. First is we need to prepare the equipments. So our equipments include a 3cc syringe, an extra needle, an ampule of sterile medication, our dry and wet cotton balls, our waste, our alcohol, and then most importantly, the MAR of the patient. Then we head on to the preparation. First thing to do is we need to check the MAR of the patient, then compare the ampule of sterile medication, check the drug name to ensure that the right medication will be given to the right patient. And then check for the expiration date. And then make sure to assess the overall condition of the ampule. Make sure that there are no scratches or punctures, especially for this plastic ampule. And then organize our equipment. Then we head on to the performance proper. So first thing to do is we need to apply hand hygiene. And then prepare our ampule for withdrawing the drug medication. So we have here our ampule. So first thing is we need to flick the upper portion of the ampule using our fingernails for several times so that the medication will drain down to the main portion of the ampule. Like this. And then with a cotton ball, apply alcohol and clean the neck of the ampule. And then with this cotton ball, you can use this to break the ampule using the bending technique away from us so that we do not risk our hands from any cuts or any broken fragments from the ampule. So usually this technique is used for breaking the glass ampules. Or if you have an antiseptic wipe, you can use that to cover the neck or the head of the ampule to break it so that the fragments of the broken glass from the ampule will fall into the antiseptic wipe of the antiseptic wipe. And then after breaking the ampule, discard it and place it into the sharps container. So since I have a plastic ampule, I'm just going to twist it. So I'm going to use another cotton. I'm going to twist it. And then discard it into the sharps container. And then prepare our syringe. So if available, you can use a filter needle to use and inject it into the syringe so that the broken fragments will not be withdrawn into our syringe. So since I don't have a filter needle, I'm just going to use this normal syringe. So suppose I am going to withdraw 1 ml of medication. I'm going to draw 1 ml of air as well. So this withdrawing of air and inserting it inside the ampule will prevent it from forming any vacuum of air inside the ampule. Also, a small amount of air injected inside the ampule will make it harder to withdraw the medication. Also, if too much air will be injected or inserted inside the ampule, will force the medication to withdraw itself into the syringe. So it is wise to inject the appropriate or right amount of air into the ampule. So I am going to inject this air and then make sure to withdraw the prescribed amount of medication. And then in withdrawing the medication from the ampule, make sure that the needle does not touch the rim of the ampule and also for the shaft. But if it will touch, replace the needle with a new one after withdrawing the medication. Then lightly flick the barrel of the syringe so that the air will settle at the top of the syringe to be injected after. Then cap it back with the cap. And then replace the needle with a new one. This technique will prevent the patient from experiencing any irritation upon injecting the medication or injecting the syringe into the injection site of the patient. And then discard all of the equipments properly and appropriately. And then after, apply hand hygiene. And then document all of your findings or document all of the things that you have done and assessed. And then affix your signature. Good day, my name is Elaiza R. Parone, a BSN 1 student from Block A. And today I'm going to perform preparing medication from vials. So first thing to do is we need to do assessment. First is we need to assess the client's allergies of the medication, assess the client's knowledge or needs or learning needs on the medication, assess the intended route, assess the drug action such as side effects, interaction or adverse reaction, and then assess the obtained medication for clarification and expiration date. And if possible, perform appropriate assessments such as checking or obtaining the vital signs of the patient or checking the laboratory results specific to the medication. Next is to do the planning. First is we need to gather our equipments. So we have our syringe. This is a 3cc syringe, an extra needle, our vial of sterile medication, our alcohol, our dry and wet container, and also our waste container here, and most importantly is the MAR of the patient. Next is to do the preparation. So first thing to do is we need to check the MAR of the patient and the vial of sterile medication. We need to compare the drug name and the MAR to ensure that the right medication will be administered to the right patient. Also check for the expiration date. And then check the overall condition of the vial. Make sure that there are no cracks. Then, organize our equipment. And now we head on to the performance. First thing to do is we need to perform hand hygiene. Then, we prepare our medication vial for drug withdrawal. So first is we need to mix the solution of our vial using both the palms of our hands. Since some vials contain aqueous suspension which settles at the bottom of the vial, then shaking the vial will cause the forming of bubbles which we do not want to withdraw bubbles into our syringe. Next is to remove the cap, and then clean the rubber cap using our cotton ball and our alcohol. And then clean the rubber cap for at least 30 seconds. This will reduce the number of microorganisms on the vial. This is we dispose this cotton. And then prepare our syringe for the withdrawal of the medication. So if possible or if available, use a filter needle and then insert it into our syringe. This will prevent withdrawing of the solutions or any particles inside the vial. So since I don't have a filter needle, I'm just going to use my regular syringe. So suppose I am going to withdraw 1 ml of medication. So I'm going to draw 1 ml of air into the vial. This will ensure that, or this will prevent forming of vacuum inside the vial, and little amount of air injected into the vial will make it harder to withdraw the medication, and then too much air injected into the vial will force the medication into the syringe. So it is wise to insert the appropriate or right amount of air into the vial. So now, we will withdraw the prescribed amount of medication. With the bevel up, force the needle into the rubber. Then use the inverted technique. This, this inverted technique with the tip below the medication will ensure that no air will be withdrawn into the medication. Then, tap on the barrel of the syringe lightly so that the air will suspend into or at the top of the syringe to be injected out of the syringe later on if we were going to withdraw the medication. Next is to cap our syringe back, and then if we're going to administer medication, we need to change the used syringe with a new one. So, upon administering or injecting the patient, we must change the old or the used needle with a new one to prevent the client from experiencing any irritation upon administering. Next is to clean our area. Dispose all of the supplies appropriately. Then apply hand hygiene.